Hello, my name is Robert Hoffman. I would like to talk to you about methionine addiction in cancer and how methionine addiction can help us understand the very molecular basis of cancer and also gives us a general target for therapy. I discovered methionine addiction in 1976 when I was a postdoctoral fellow at Massachusetts General Hospital and Harvard Medical School. I tested a number of different cancer cell lines, and I found that they made a lot of methionine, but it was insufficient. They needed external, exogenous methionine in order to grow and survive. The level of methionine these cells made was at least as much as normal cells, but normal cells could live on low methionine and grow and proliferate, but cancer cells cannot. On low methionine, they stop growing and they eventually die. Today I would like to focus on the practical aspects of methionine addiction for therapy. The key point for therapy is to starve cancer cells of methionine. The cancer cells of all types of cancers are methionine addicted. They need high levels of methionine to proliferate, as I mentioned. So if methionine is restricted, for example, by diet, it is possible to slow the growth of the cancer. However, slowing the growth by just diet is very difficult. One has to have a diet that's very low in protein. It's not nutritious. And if you're on this sort of low methionine diet, it's very possible to suffer severe weight loss over time. We found another way to restrict methionine in the body, and that's with an enzyme called methionine-ACE, an enzyme that degrades methionine. When we first started developing methionine-ACE for cancer therapy in the 1990s, we had to inject this foreign protein into mice, into monkeys, even briefly in patients. However, injecting a foreign protein into the blood has potential toxicity, especially anaphylaxis. In approximately 2017, Dr. Hahn in our laboratory at Anti-Cancer Inc. found the very surprising and great result that methionine-ACE, even though it's a large protein, can be taken orally and survive the acid of the stomach. This was very surprising. Taking proteins orally is a kind of the holy grail. People would be so happy with diabetes if they could take insulin by mouth, but they cannot. Insulin cannot survive in the stomach. Methionine-ACE can. Probably methionine-ACE, which comes from a soil bacterium called Pseudomonas putida, evolved to be acid resistant as it resides in a very tough soil bacterium that can withstand all kinds of environmental changes of acidity and heat. Oral methionine-ACE proved to be very effective in mouse models that we have developed called PDOX, patient-derived orthotopic xenografts. That's a hard name for saying that we found a way to implant the patient's tumor on the same organ of special mice that can accept human tumors. oral methionase proved to be highly effective against all kinds of different cancers, and even very recalcitrant cancers such as sarcomas and pancreatic cancer. It was very surprising. And oral methionase was shown to be as effective as injectable methionase. Then in 2019, we started to give patients some oral methionase as a supplement, not as a drug. And our first result was with a prostate cancer patient who was very sick, had metastatic prostate cancer, and his bone marrow could not make hemoglobin, had a PSA level of over 2,000. In 3 months, oral methionase lowered his PSA level 70%. And he began to make hemoglobin in his bone marrow. We gave oral methionase to a number of different patients. All had some beneficial effect. Now we are developing oral methionase as a supplement. We hope we can make it available to everybody once we are able to build a larger facility. Methionase is produced by fermentation, similar to how beer is produced, but with the case of methionase, the organism that produces it, in our case, recombinant E. coli, a common bacterium, is produced by the fermentation. And these bacterium are opened and the methionase is purified, and readily purified since it's very highly heat stable. So we see a bright future for oral methionase, especially for cancer patients that have very advanced disease and have no other options. We believe methionase can at least partially control their tumors, and maybe better. We don't want to make too many claims right now, but our experience thus far, although limited, is very positive in helping advanced cancer patients control their disease. In the near future, we will also choose chemotherapy to co-administer along with methionase, and to see if we can get some synergy to help control and hopefully regress and maybe even cure advanced cancer. This is our mission right now, and we hope that we can help every patient in great need. Thank you very much for your attention.